Hello everybody, this is Dr. Shafiq Safi live from Centre Endodontics Saint Laurent in Montreal, Canada. Another important question that I keep on getting often from my patients is, can I eat on this tooth after having a root canal done? And the simple answer to that is yes, you can, but not right away. I usually recommend the patients to wait about 4 to 8 hours before chewing on the side where the root canal was done, just to allow some time for the patient to be used to the new reality of a root canal and of a filling. And I would also recommend for the patient to start with something that is soft and increase in terms of hardness of the food. So for example, I recommend my patients to start with something that is soft like pasta, rice, and then slowly have something that is as hard or crunchy as peanuts or anything that's in this range. What's very important, however, also, and that this is what I mentioned to my patient, is it's important to get a crown on that tooth. And this is another question that I get from the patient, which is it important for me to do a crown with my dentist, and how soon should I do it? And the crown on a root canal treated tooth has two functions. And the first one is a mechanical function to protect the tooth from the masticatory forces and from the stress. And the second one, which is to seal the tooth so that nothing can go inside the root canal, which we had just cleaned. So yes, the crown is important. It should be done as soon as possible. And eating on that side where the tooth is acceptable or is okay, but we should wait about 48 hours before doing so, and increasing the food, if you want, consistency from softer foods to more hard foods in a couple of days. Again, if you have any question or any concern concerning this issue, or if you have a root canal that was done and you don't know how to react or how to take care of your tooth or what are the next steps, please don't hesitate to contact us by phone, by email, or on our website www.endosaintlaurent.com. Thank you.